Hi everyone, in this video I'm going to show you how to create a patient chart for Marsupial EMR using Marsupial Editor. Marsupial Editor is the application instructors can use to create a patient chart or edit the patient chart after it's made. So right now I have Marsupial Editor open. At the bottom here I already have a patient database open, so if you're ever unsure of which database you're editing, at the bottom here it'll tell you the location of the database you're editing and the name of it. I have a bunch of patients in here right now that are already made. This file is included with Marsupial EMR as kind of a demonstration database to show you what the charts can look like, how they should be organized. It mirrors pretty similarly to what you'd see in a hospital. We just have to create that for ourselves for each patient. So if you want to use the provided patients as an example, please do. But again, you can make your own patients, and I'm going to walk through how to do that here next. We're just going to look at one of the patient charts really quick to see what it looks like. Whenever you click on a patient, some new options on the top will pop up here. We can open a chart. If you click the patient and then click open chart, it'll open it for you. And at the bottom of the screen here, again, it'll tell you which patient you're editing if you ever forget. Once you open a patient chart, all these new tabs will open up here to be viewed and edited. So, all your notes, orders, results, imaging, flow sheet, your MAR entries, and states, which is a new feature in version 2. Each patient will have their own demographic information too. So if you want to edit that, you just click on your patient and click Edit Patient, and that'll pop up a window and it'll let you edit their demographic info and things like that. You can also delete a patient. We can copy a patient and import a patient. I'm going to walk through a couple of those in a little bit. But first, I think we're going to show you how to create your own database. So I have this database open right now. It's instructorvideo.db. It's one of the demo databases that's included with Marsupial. There's also another one I include called blank. So it's blank.db. So you'll probably want to start your own patient database using the blank database, and then create your patients in that. So you don't want to use the blank one. You want to make a copy of it and then create your own database. So we're going to do this in Windows Explorer. You can just right click on blank.db and go to copy, and then just paste it again, and that'll make a copy of the blank one. And you can just rename it to whatever you want it to be. So we'll just call it demo charts. So when I create a patient database, I put all the patients I'm going to use in my curriculum in one database file. How you do that is up to you. Maybe you want to have one database file for each class, but I just put them all in one so I don't have to keep opening and closing different database files. All the patients are in one, and it kind of looks more realistic because you have a bunch of patients that show up when the students go to use it, kind of like you would in a real hospital. So let's open up our demo charts database in Marsupial Editor. So whenever you're opening a database, you have to do it inside of Marsupial Editor. If you go to the File menu on the top left, you'll have a couple different options: Open EMR database, Open Medication Library database, and then Open a monograph database. So the EMR database, that's the patient charts. So for example, the instructor video DB, the blank DB, and the one we just made, the demo charts DB, those would all be EMR databases that have patient charts in them. The medication library database is a separate database. I have one here called Med Library. That holds all of the scannable barcode medications that would be used for administration. And then the last one was the monographs. The monographs are used with the integrated drug library in Marsupial EMR. So the monographs in the med library come with Marsupial EMR. They're kind of like the ones I use. You're free to change them. You will definitely have to change the med library for the medications you have at your facility or at your campus in your lab. But you can use this as a reference and a starting point. The monographs has a lot of drugs in there. You may not have to edit that, but it is possible to, if you're missing a drug in the drug library, to add your own entry into the drug library in the monographs DB. All right, so let's open up our EMR database. We're opening up our demo charts that we just made. This is going to be blank because there's no patients in it. So there's a couple different options for when you're making a new patient. You can just click new patient and it'll let you fill in all this demographic info yourself. You can also import a patient from another database. So we're going to do that. This sometimes might save you some time if you have like a patient that's kind of similar. Maybe you already had a patient made before and you want to import it from, for example, the instructor video DB that I provide with Marsupial. Maybe there's a patient in there you want to copy from or edit. You can do that. So let's import a patient from this instructor video database. It'll ask you which patient you want to import from the instructor video database we just opened. So we're just going to go with Tristan Ali because I have a bunch of stuff in there already. And we're going to click import. And that's basically just going to copy Tristan Ali patient and everything associated with that patient, all their orders, results, notes, and so on, into our new database. So now we have this patient here. And everything should be the same. If we open it up, what we looked at before is all going to be in here. One improvement from the last version of Marsupial Editor is that if you're importing or copying a patient, you have to manually remap some of these order IDs. That's now automatically taken care of, so you don't have to worry about that. All right. So now we have a patient we can kind of copy things from or look at as a reference. We're going to create a new patient, a blank patient, and then I'll show you kind of what my process is for creating a new patient. So we can just fill in some random information here. You can make it whatever you want. Let's say we're going to use Michael Holloway is going to be our patient's name. The medical record number has to be 9 digits or fewer. So we're just going to go, let's see, 146891. It's going to be our MRN. We'll say he's a male. Age can be 55. When we're entering the age, in this age box, we're just entering the numerical part of the age, and then the age units you can pick whether they're going to be years old, months old, or days old. So our patient's going to be 55 years old. The birth month, I will just say April 2nd. Days admitted. So Marsupial uses a relative date system. It's always going to, like the current day that you open Marsupial is always going to be day 0. And then anytime, if you want to put something in, let's say the patient got admitted yesterday, then that would be 1. So it's always, I just think -1 days, that would be yesterday. If I wanted to put that the patient got admitted a week ago, I would put 7 for days admitted. This is a nice feature because the dates are relative. There's no hard-coded dates. You never have to like continually update your sim every time you run it for the dates. It's always going to be 0 is always going to be today, and then everything will be subtracted from there. So we'll just say the patient got admitted today. We'll make that 0. The physician, you can put whatever you want here. I'm going to put Dr. White. A diagnosis, we can do whatever we want. Allergies, again, can be whatever you want. We're going to say it doesn't have any allergies. A new feature in Marsupial version 2 is the ability to have profile pictures for a patient in the EMR. There's a default that will be loaded here, which looks like this up here, just a default kind of blank photo. But you are able to get your own profile pictures, however you see fit, and it'll load them in that profile pic for your patient. So in this box here, if you want to use your own profile picture, then you just have to type the file name, and the files are all stored in wherever you have Marsupial EMR loaded. Right now I have it in my documents in the Marsupial folder, and then I have Marsupial EMR. So in this images folder, I have a bunch of images, and this is where Marsupial EMR will look for images for diagnostic imaging or the profile pictures like we said before. So just to demonstrate, I'm going to use a photo of this dog here. So the name of the file is photo1. It's a JPEG file, a JPG. So I'm going to put photo1.jpg in this box. The last option here is a show/enable patient. This will give the ability to like hide patients temporarily or permanently if you don't want students to see them in the patient list when they open up Marsupial EMR. So for most cases, you're going to want your patients to be enabled, obviously. But if you do want to disable the patient, that is an option. So we have everything filled out here. We're going to click add for our patient. And now we have Michael Holloway as an option here. We still have Tristan Ali opened. You can see down here. So we're just going to double click on Michael Holloway, and now we're editing Michael Holloway. So everything in here is going to be blank. We're going to have to manually create all these things. I'm going to walk you through each tab and how to create like notes, orders, results, imaging, and so on. Give you some examples of how to do that. So let's look at notes first. It's probably one of the easiest things to make. When we click on the notes tab, we have new note, edit note, delete note, and copy to. So we don't have any notes to edit or delete or copy. We're going to click new note. It's going to pre-fill some stuff for us like the MRN. Everything you create in Marsupial is tied back to the medical record number for that patient. So you're not going to be able to edit the MRN for anything. The date, again, we use a relative dating system here. So if we want to put a note in the EMR that will show up as like today, then we'll pick 0. But for example, if the patient got admitted yesterday, we could have an admission note timed for yesterday, we would pick 1. Because our patient got admitted today, we're going to pick 0. The author, let's say this is going to be a physician's note. So we're going to put our physician's name here. The note type can be anything you want. We're going to say it's a history and physical. The time of the note is when the note was going to be shown as written. We'll say the patient got here early in the day. We'll make the note for 7:50. A note on the times. Anytime you're entering a time into Marsupial, it has to be in this 24-hour format with a colon between the hours and minutes. So it could be something like 07:50 or maybe something like 22:15. Has to be in that format. The discipline, we'll say internal medicine, but again, this can be anything you want it to be. And then this box, you just type your note. So maybe it's going to be some kind of soap note. You can write that down. And just fill it out as you see fit. Another option is maybe writing the note in a word processor like Microsoft Word and then just copying, pasting into this box. That might be easier as well. The last option here is our show enable note. If you want to hide a note and make it not visible to students, uncheck this. Most notes you're probably going to want to display though. So we'll click add. And that'll be a note that'll show up to our students when we open up Marsupial EMR. If you want to edit the note, you can just double click it. You can change anything here. You can also click the edit note button. If you select a note, you can delete it. Another option is to copy a note. This is like useful sometimes if you don't want to fill out every single box when making a new note. We're just gonna maybe start from a copy. So you can copy it to different patients within your database. It'll default to copying it to the patient that's open right now. So a lot of times when I'm making new things, I'll just make a copy and then edit the copy. So now if I want to put a note that was maybe a couple of hours later, I can do that, and then I can just change stuff from there. All right, let's look at imaging next. Let's click on new image, and then we can make a new image. It's very similar to the notes. We'll select our date as today, our time as, say, 7:30. The imaging type, there's some preloaded imaging types in here. You are free to type your own though, whatever you want it to be. So we're just gonna pick EKG. We have a option similar to that profile picture, works the same way. We have a file name that will be used for our imaging, the actual image for our imaging. So it's going to default to this no photo specified.png. That is a file that comes with Marsupial EMR. It's just a blank white image. So if we want to specify something here, like an actual EKG image, we can do that. And Marsupial EMR comes with a couple EKGs. You're free to download your own EKGs and use those. But let's say our patient's going to be normal sinus rhythm. We have this EKG-NSR. It's a PNG file. It's going to be .png. So I'm just going to copy this name. I'm going to paste it into my file name. I know it's a PNG file. Make sure this matches what you're trying, like exactly. Otherwise it won't show up. It has to be a file inside this images folder within Marsupial EMR. The interpretation would be your narrative interpretation if you would like one. We'll just say it's normal sinus rhythm. And again, you can show or hide the image or the EKG from the students. So an example of when you might want to hide an EKG is, let's say we've got, let's say during the simulation, your students are going to receive an EKG mid-sim, and you want it to pop up in the middle of the sim. So we can make an EKG and hide it initially, and then, or disable it initially, and then during the sim, we'll be able to show or enable that image. So there's a couple of ways that you can do that. I'm going to talk about that in another video. You can show or enable hidden things using the Marsupial Instructor application. That will let you remotely control the EMR from another computer. Let's say you have the computer the students are using the computer in the sim room, and you have your instructor computer in the control room, and you'll be able to control the EMR remotely from the control room. So that's one example. Another way you could enable or show things during a sim is to use the states function. The state function is new with version 2 of Marsupial. This will let you pre-program state changes into the EMR. So you could have state 1, state 2, state 3. And these would all be like predetermined states that you could program the EMR to show the EKG in state 2. There's a way to remotely control the states. So you could advance from state 1 to state 2 remotely using Marsupial Instructor. Or in Marsupial EMR, there's a next state button that students would be able to advance when instructed to. So this is another new feature in Marsupial EMR that's really nice. I know some people were having issues with being able to control Marsupial over the network. Now you don't have to do that. Now you can control and change the state of the chart locally on the student's computer. They'll just have to tell them to hit the next state button. The number next to it will be the current state the chart is in. So this patient's on state 0. When you hit the next state button, it'll advance to state 1, and all those changes that are pre-programmed in the chart will take effect. For example, if you had some imaging, like an EKG, that was hidden and you wanted to show it for state 1, and they click this next state button, it'll advance to state 1, and the new imaging button here will start flashing red. They can click that, it'll show the EKG that was hidden. So I'll go over that in more detail in another video. It's more complicated, and this is kind of just like an intro. So let's get back to the imaging here. We want this imaging to be shown to the students. We're just going to click add, and then now we have an entry here. We're going to make a copy of this, and we're going to say we have another EKG. Maybe it was a couple hours earlier, maybe at 5:45, and they were still sinus rhythm. So now we'll have 2 EKGs when we open up the patient's chart, one at 5:45 and one at 7:30. They're both normal sinus rhythm, and it's both using the same image. They're both enabled. That's basically imaging. Again, I think the most important part is making sure if you're using an image, which you don't have to, making sure it is the exact file name with the file extension, and the images are in your images folder where Marsupial EMR is. All right, let's look at the flow sheets. So there's 2 different flow sheets in Marsupial. You have the vital signs and I&O flow sheet, and then you have the assessment flow sheet. They're pretty similar, almost exactly similar. They just show different things. So let's look at the EMR real quick. Let's look at this Tristan Ali patient. I'll give you a demo of that imaging that we just put in there. This is from a different patient, of course, but this is what it would look like to the students. As well as the notes. Let's look at the flow sheet here. Again, this is a different patient, but this is an example of what your flow sheet could look like. It looks similar to what you would see in a real hospital environment. There are 2 sub flow sheets here, the vitals and I&O flow sheet, and then the assessment flow sheet. So The vitals INO flow sheet's going to have most of your like patient care, vitals, intervention, oxygenation, pain, height and weight, intake and output stuff. And your assessment will have your head to toe assessment. So you can preload stuff in here, like this patient has a bunch of stuff preloaded to make it look more realistic to the students. You don't have to do that. A lot of times, for example, I just don't have time for the students to chart an assessment during a simulation, so I don't even fill out anything in the assessment column. It's up to you what you're going to want to use during your simulation and how much information you're going to want to backflow or backchart into your patient chart. I do try to put some stuff in here so it looks like someone else is taking care of the patient already, like they would see in like a real clinical environment. It is kind of time consuming to do that though. So again, it's going to be ultimately up to you how much info you want to put in here, or if what's appropriate for students to see. Maybe you want them to figure out something and you don't want to give them too many clues. All right, so every entry in the EMR here is entry in Marsupial Editor. So for example, if we wanted to add this blood pressure here at 0407, we have to, let's create this in our patient. Let's create these vital signs in our patient. Two ways to create new vital signs. You can create one new entry, or that's the new vitals button here, and that'll let you just create one box in the flow sheet. Another way would be to use this new vitals panel button. The new vitals panel will let you put a whole category of things in here. The only one I have available for a panel is the vital signs, because it's mostly what you're going to be putting in there all at once. So let's make a new vitals panel entry because it's a lot easier if we're going to do vital signs to do that. Let's say our vitals are going to be taken at 7 a.m. and it's going to be for today. We'll add that, and then it'll add blood pressure, heart rate, respirations, pulse ox, and temperature for you. And then you just have to edit these. It's going to take that time you entered there and put it for each one. So if we want to change our blood pressure, we just double click it and we can put our data in here. The heart rate, respirations, and our pulse ox and temperature. And now we have a bunch of vital signs for 7 o'clock. If you want to make vital signs for 8 o'clock, you can do that pretty easily. Now we just got to enter our data again. Another option is you could always make a copy of something here. Like let's say we just took one temperature 3 hours from now. You could just copy your temperature and just change the time. Let's say our patient's temp then was 36. That's another way you can make a new vital signs entry. Let's open this up in Marsupial EMR and see what it looks like. So we are editing Michael Holloway. You can see our profile picture here is the dog. Probably want to use a human picture. The notes we made, the EKG. Another new feature is you can zoom in on these EKGs if you scroll the mouse wheel up and down. So really easier to see things. You can also pan. And then whenever you open another imaging file, it will reset the view. All right, let's look at the flow sheet we just made under Vitals INO. So we had a couple of a vitals panel we had at 7 a.m., Those are the values we entered. This is that temperature that we put in. And then for the 8 o'clock one, we didn't actually put any values in there, so it's showing us blank. But how much data you want to put in here is going to be up to you ultimately. Adding an assessment, same idea. You can add individual assessments. Like if you wanted to add a level of consciousness assessment, or like the vital signs, you can add a new assessment panel, and then all the body systems for an assessment would be in here, and you can just add the whole body system. Marsupial, for the assessment, it uses a chart by exception type of charting philosophy like most hospital EMRs are going to. So you're going to have like a WDL field that you can either put WDL or do WDL accept. And then if you want to change the level of consciousness or orientation, and then again, how much of the assessment you want to put in is going to be up to you. All right, so that's basically the flow sheets. A couple more comments on the vitals portion of this. Some of the vital signs are going to require units. So if you ever see this star, this asterisk here, that means you can hover over the field. It'll give you a tooltip with some more information. For the units, this is only required for measured data. So not every field's going to have a unit. For example, if we're doing a rounding on our patient for daily care, we're not going to have a unit for that. You would just put safety check completed. But some fields are going to have units. So just make sure we put the units in there in the units field. There's some units preloaded in here already of kilograms and centimeters. If you want to use inches, you can use inches. You just have to type in that. All right, so let's talk about results. So results is going to be all your lab results. Kind of similar to what we just talked about with the flow sheet assessment. We have a couple different options to make a new result. We have new result, which will just let you create one individual value, like a potassium or a sodium value. The other option is to use a new results panel, which will let you choose a whole panel of lab results. So I have some predefined ones here already. You have chemistry, hematology, coags, blood gas, and a urinalysis, just to save time so you don't have to manually enter each of the lab from like a basic metabolic panel. So for most cases, you're going to want to use the new results panel. Let's see, our lab results were collected at 6 a.m. We're going to make a basic metabolic panel. This order ID has an asterisk. It says this value is currently ignored. So I don't ever change this. It's not currently used by Marsupial, so don't worry about it. The show enable results, we have that option again. If we want the results to be shown to students, then we'll check this box. If we want to hide it to show it later, maybe mid-sim, they're going to draw some blood and get some new lab results, you want to uncheck this so that you can show it or enable it either remotely through Marsupial Instructor or through the states function. We're going to put our labs as show. so the students can see them. And when we click OK, we have a whole basic metabolic panel that pops up. All the results are blank, so you're going to have to go back in and manually fill in these results. Just double click it and it'll automatically move the cursor to the results. So we can say our patient's blood sugar was 135. Their BUN is 20. Again, you just got to put whatever you want here. You can leave some stuff blank if you don't have to enter a lab result for everything if you don't want it. If you want the whole result to just not be here, you can just click delete result. Our sodium, we'll say 142. All right, it should be good. So that's results. Again, there's different results panel options. There's hematology. I'll show you that real quick. So we have a white cell count, RBCs, hemoglobin, hematocrit, and platelets. Again, you can just click it and change the result to be whatever you want it to be. For the results, there are default ranges already pre-programmed into Marsupial. And whenever you change the lab type, it will change the range for you. So let's say we want to change this white counts to a hemoglobin. When we pick hemoglobin, it'll change the range to a typical hemoglobin range. All the ranges are here. It's kind of hard to tell what they match up to. So I usually just rely on clicking whatever lab I want. There are a whole bunch of labs pre-programmed into Marsupial. I think they're the most common ones people are going to be using. You are free to type your own in here though. So if you don't see a pre-programmed lab value, you can always just type it in. For example, I have troponin I pre-programmed here. If you want to do a troponin T, you can do that. Just make sure you change the range and make sure that the range is consistent between all the troponin T's you add in here. There are a bunch of different lab categories as well. So again, I think these are the most useful categories people will use, but you are free to also pick your own lab category. And how that will show up in the EMR is here, for example, we've got this hematology category. That's the lab category. Chemistry is a lab category. And then each of the individual results will have their lab type. And then the actual results. So I don't have any labs programmed in Michael Holloway. Right now, everything we're editing here is in the original database, the democharts.db. So if you can have Marsupial Editor and Marsupial EMR open at the same time. You're not going to see your edit show up in Marsupial EMR though, because every time Marsupial EMR starts, it makes a copy of the database and then edits that copy. So if we look in our user database folder, we're going to have the original database, democharts.db, and then we have this democharts.db.marsupial. So this Marsupial file is a temporary database file that is the copy that's made every time you run Marsupial EMR. And this is the one the students edit. So the idea is that the students are never editing your original. Every time you reopen Marsupial EMR, it's going to make a new copy from your original database so that it never changes. The only one that changes is this copy. So this is nice if you're having back-to-back sims, for example. So you have one group at 7, next group at 7:30. When the first group's done, you just close out Marsupial EMR, reopen it, and it'll get written back to its original state with none of the patient charting in there. So just keep that in mind when you're editing things, it's not going to show up in the EMR until you reload it. So you can either close this and reopen Marsupial EMR, or you can just go to Open EMR Database and reopen the original database here. And now we'll have the lab results we put in there. So I do that a lot when I just want to test out my edits and see what it looks like. I'll just reopen the database in Marsupial EMR. All right, so that's results. I don't think there's anything else I can mention there. I do use the copy feature a lot with results. Let's say for example, let's say I was making a troponin, and I had like serial troponins, right? Let's say they had a troponin drawn when they came in, and it was 0.02. Well, let's say I wanted to make a troponin 2 hours from then. I can just copy it to the same patient. Let's double click this new one. Let's make it 0.05, 2 hours later. And we'll save it. And now it's up here at the top because it's the most recent. And we'll say I want to make another one. Just copy it, change the time, change our value. All right, so that's results. What haven't we covered? I guess orders. Orders is the big one. So let's look at Tristan Ali patient and look at what their orders look like here. So, all right, we can see we have a whole bunch of orders, demo orders from this patient we copied from the instructor video database. I have a bunch of orders in here already. This is kind of what it's going to look like once you have it all done. Again, how many orders you put in is going to depend on your preference. I try to make it look as realistic as possible, or as possible as a real patient's chart. So I have communication orders for vital signs, ambulation orders. I've got a telemetry order. I've got consults, labs, meds. Respiratory orders, nutrition orders, like a diet order. So again, it just takes more time to get everything set up. How much you put in there is going to depend on what you want it to look like. So when you are trying to make new orders for your patient, a lot of times I'll just copy orders from a patient that's already previously made into my new patient, instead of manually remaking each order. You can do that if you want by clicking the new orders button and manually filling everything out. Sometimes you have to do that. Let's say I want to make a nursing order for vital signs. Q4 vitals. It's going to be an active order. There are options now. That's another new feature in version 2 is you can make orders active, completed, or discontinued. We're going to have this order shown or enabled so students can see it. This box down here is for medication orders only. So we don't got to fill any of this out. It's grayed out. We can't fill it out. If you want to write a comment, you can. It's not necessary. We'll click add, and now we have a new vital signs order. Another way would be to go into a patient that already has a bunch of orders made and just copy it to Michael Holloway, our new patient. So we have a vital signs Q4 hours here. Let's just copy it to Michael Holloway so we don't got to type all that stuff out again. Just go to copy to patient. We'll pick Michael Holloway and hit copy. And now if we go open Michael Holloway, we'll have that order there. Keep in mind though that your date and time and maybe the enabled status and if it's active or discontinued could be not what you want because it was from the other patient. So make sure you change anything to make it match what you want. But that's usually how I save time, so you don't gotta recreate everything for every patient. You can just copy a bunch of stuff. So we'll say this patient's we have a bed rest order here. Michael Holloway is gonna be a bed rest, so we'll just copy that over. From Tristan Ali to Michael Holloway. We've got a daily weight. We're gonna want that one too. Hourly intake and output. Let's copy that. Let's go back to Michael Holloway, look at his orders. Now we have all these orders in here. We just got to change the times and dates and whether they're enabled or not. So that's probably the easiest way. You can use my demo patient and copy stuff, or you can make your own patient, go through it once, and then you just have like a lot of your orders already made. Then the only time you have to really make a new order is if it's something you haven't put into a patient before. So when you're making a new order, there's a bunch of already like pre-filled order types in here. You have admission orders, advanced directives, labs, meds, nursing orders, nutrition orders, respiratory orders. You are free to make your own category. Let's say you wanted to put consults in here or whatever. Your description is going to be like the actual order, what the order is. So for example, we had daily weights, we had vital signs Q4. That's your description. Your comment could be some extra information, maybe for the nurse. Let's say, I don't know, not a great example for daily weight. Let's say, take weight at 0600. So that'll show the students a little comment under the order, some extra information. The most important one here is going to be the medications order type. If you're putting a medication order, then this has to say medications. That's how Marsupial EMR tells medication orders apart from everything else. It handles medication orders a lot differently than the other orders because we have the MAR. And we can do barcode scanning medication administration. So this has to say medications if you're putting a med order in. And when it says medications, when we selected it from this drop down, all these medication specific fields will be available to be edited. So down here we have the route for the medication. It's going to be enteral or parenteral. The administration route is kind of like the secondary route, where it's going to be, if it's enteral, it could be like PO or rectal, or if it's parenteral, it could be IV push, subcutaneous, IM, and so on. So let's just make an order for, a medication. So the description here is going to be, whenever we're making a medication order, the description is going to be the generic name of the medication. There is a spot down here for a brand name now. That's new in version 2. You can type the brand name of the medication here. Another new feature is the ability to search the medication library and automatically enter a bunch of data for this fields based on our medication library. So let's do that. Let's pick a medication out of our medication library to make an order for. We're going to have to pick the medication library we want to open. I only have one. It's called Med Library. And now this is what our medication library looks like. So we can't edit the med library here. We can only pick meds out of it for our order. Well, let's say we want to give let's give furosemide IV push. That's pretty common med. So And this medication library, the demo one I provide with Marsupial, is already a bunch of meds in here. You'll notice that we have the generic name for all the meds, the barcode associated with the specific formulation of furosemide. It's a 100 milligram vial of furosemide, so it's meant to be given parenterally, right? So I have this specific barcode for this specific dosage of, like, for the physical vial of furosemide. At my campus, we have 100 milligrams of furosemide in 10 milliliters. This is a demo dose barcode. So we buy a lot of our drugs from demo dose. This is the barcode that the demo dose comes with. So anytime I'm scanning furosemide, that's the barcode it's going to see for the 100 milligrams and 10 ml physical vial. There's a whole bunch of pre-programmed ones in here. You can edit the med library in Marsupial EMR or Marsupial Editor. That's going to be another video. So if you want to see how to edit the medication library, check that video out. There'll be a link in the description. But for now, we're going to make our furosemide order. Let's just double click that, or you can click the select med button, and that's going to pre-fill a bunch of this information out for us. A big consideration with medication orders is that our order description has to match what's in our med library, has to match the medication name, the generic name in our med library. So that's how Marsupial can tell what we're scanning matches the medication order. Just like in a hospital, like, you have to have an order that's specific for what you're going to physically give. It has to match, this description has to match the generic name of the drug in our med library. So if I want to give furosemide, I want to scan furosemide, I want my students to, like, physically scan meds on the MAR, then this generic name has to match the medication order description. So it'll pre-fill that if you use the search med library. If you don't use the search med library, then you have to manually type this out and make sure it matches the drug in the med library. If you're not going to scan anything, it doesn't really matter. But if you're going to be scanning meds, your students are going to be scanning meds, then this has to match something in the med library. Exactly. So we're going to give IV push furosemide. We picked the parental med in the med library, so it pre-filled this for us. It's IV. We'll pick IV push. The dosage, the vial is 100 milligrams, so that's what it pre-filled here. Let's say we're going to give our patient 40 milligrams as the order. The frequency is how often it's going to be. We're going to say Q 8 hours. The interval is either scheduled, PRN, or continuous. So in this case, it's going to be scheduled medication. You can do PRN meds and you can do continuous infusions. So depending on what you select here, some of the options will be different. Because we're giving a scheduled med, and most of your meds will probably be scheduled, we're going to have a set dosage and units and frequency. So, for example, if we were going to give a continuous infusion of furosemide, maybe we had like a Lasix drip, some of our fields would change. So it's going to know our frequency is continuous automatically. And instead of a dose, we're going to have a rate. And instead of units, we're going to have a rate units. So whenever you're doing like a continuous infusion of something, you're going to have like an order for a rate. And your students will enter a rate when they go to sign out the medication. If you're just doing a scheduled med or a PRN med, you're going to have a fixed dosage. You can see this dose has a little asterisk here. Let's hover over that. It says leave dose blank if a range is acceptable, and type the dose range in the comment. So you can have ranges for meds too. I'll give a demonstration of that after we do this. We'll do an insulin order next, and I'll show you how that would look for like sliding scale insulin, where you don't have a set dose, you have a range of a dose. So let's go back to Q8. Our brand name, the brand name's optional, you don't have to use it. If you want the brand name to show up though, it has to be entered in the order. And there is an option in Marsupial EMR to turn off showing brand names. So you don't have to you can have this in here filled out and still have the option to show or not show them in Marsupial EMR. Maybe you don't want your students to see the brand name. You're trying to force them to learn the generic names. Up to you. I would recommend filling this out if you think you will use brand names at some point. Let's fill out our time. So the date and time, we're filling out a medication order. So the date and time here is the time of the order. So the time the physician put the order in. So let's say the physician put the order in at 7 a.m. today. I think everything looks good here. Let's hit add. Now we have a medication order here. So there's two components of medication orders. You have the actual order, and then you have the MAR. So let's take a look at Marsupial EMR here real quick. We're going to open up Tristan Ali and look at the MAR. So you can see the MAR has a bunch of different meds on it and a bunch of different administration times on it. This med here was marked as held already. We had a Lovenox that was held. We've got vancomycin that was given at 2. A bunch of PRN meds that don't have any scheduled time. So whenever we're putting a medication order in, we need these MAR entries to fill out the actual MAR. So for example, this atenolol is 100 milligrams PL BID. So that's the order. But then if I want students to see it on the MAR, I have to also make these MAR entries at 9 and 2100. So for example, for atenolol, there's 2 MAR entries for that one order. Every time you want something to show up in one of these boxes on the MAR, you have to make a MAR entry for it. Another example, insulin. It's ACHS. So we have a MAR entry at 7, a MAR entry at 1100, a MAR entry at 1600, and we should have another MAR entry up here, but I don't have it in there. So you're going to have, for ACHS, you're going to have 4 different MAR entries for this one order. For this vancomycin, I've got the orders for Q12. So the patient got a dose at 2 a.m. and they've got another dose scheduled at 2 p.m. So I have 2 MAR entries in here for this one vancomycin order. So let's look at our vancomycin order. It's vancomycin 1 gram and 250 mLs. That's just the order. If we want it to show up on the MAR, again, we have to put these MAR entries in here. So if we want our furosemide to show up on the MAR, we've got to make some MAR entries for it. And that's what this MAR tab is for. So we don't have any entries in our MAR right now. So we have to make some. Otherwise, nothing's going to show up on the MAR. So for our order for furosemide, we put the frequency as Q8 hours. 40 milligrams every 8 hours. So we need 3 different MAR entries within a 24-hour period. So we could go to the MAR tab and we could go new MAR and fill all this out. But a way easier way is to use this generate MAR button on the Orders tab. So whenever you have a medication order, if you hit Generate MAR, it'll just make a MAR entry for you. It'll pull all this data that we just entered in the order and put it in the MAR entry for you. It's way easier. And now all we got to change is the time. It's going to default as the time to give as 0001. Obviously, that's not what we want. Let's say our first dose is going to be at 6 a.m. Everything else was copied from the order. The drug name, the dosage, the units, it's parental, it's IV push, it's Q8, it's going to be a scheduled med. We do have another option down here, administered. This is what you would change if you want it to show on the MAR as like given already. That would show up as a green box, or held, which would show up as a red box. So we're going to say this med has not been given yet. And we'll click save. All right, so we know we need 2 more MAR entries for furosemide because it's Q8, right? So we could just make a copy to Michael Holloway, and we'll just change the time. It's Q8, so this should be 1400. I'll make another copy. And we'll just change the time. So this is going to be 2200. All right, so each of these MAR entries is tied to the order that we made. So if you look at the Orders tab, we have this order ID. It's 47. So that's the order ID. It's unique for each order. Each of these MAR entries has to match that order ID. If you use the Generate MAR button, it'll do that automatically for you. But if you try to just make a new MAR entry, you're going to have to manually enter the order ID. And it says in red here, in caps, must match an order ID of an order. The MAR entry will be enabled if the matching order is enabled. So for example, if you have an order that's disabled or hidden or completed or discontinued, we can change that in the order here, and that will reflect in the MAR. So for example, if we had, let's say mid-sim, our students are going to call the physician and get an order for another dose of Lasix. Let's copy this order. Let's say the sim starts at 8 a.m. And we'll say about 10 minutes into the sim, the student should be calling the doctor to get this order. We'll just make the order for 8:10. And we'll say it's going to be a one-time order of additional Lasix. Let's make it stat. Let's say it's going to be 60 milligrams. Everything else is going to be the same, except we're going to uncheck this show enable order button, or checkbox. So it's going to be hidden with this is unchecked. All right, so now we have an order for furosemide that's scheduled Q8, and it's enabled or shown. And we have another order for furosemide that's 60 milligrams stat, but it's hidden or disabled, or it says enabled is no. The order ID for that is 48. So we're going to have to make a MAR entry for this as well. We're going to click Generate MAR. Now in our MAR, we have the 3 scheduled Q8 doses, and we also have this new one down here for our new furosemide order. And we know it's different because the order ID is 48. It's the stat order for 60 milligrams. So we're going to change this time to be around the time of our sim. Oops. So the idea is the students are going to call around 8:10. They're going to get an order for furosemide. So this time to give is going to be the time it's going to show up on the MAR. So you have the order time, and then you have the time it's going to show up on the MAR. In this case, they're going to be about the same because it's a stat dose, and the physician wants to give it now. It's not going to be administered. All right. So now, because the stat dose that we just put in is not enabled, it won't show up on the MAR. So that's why having this order ID match the order is important. And if we put a comment here, this will also show up on the MAR. It'll get pulled from the order. So really important to make sure these order IDs match the order you want the MAR entry to be associated with. All right, let's take a look at what this looks like on our actual patient. Remember, we're editing the original database, but in the Marsupial EMR, we're looking at the copy of it. So we need to reload our database. It's demo charts. Look at Michael Holloway. We should have an order for furosemide that's scheduled Q8 for 40 milligrams of furosemide. Our brand name is showing up. And on the MAR, we should have 3 different times associated with that. The 6 a.m., the 2 p.m., and the 10 p.m. dose. And we'll notice that the stat dose is not showing on the MAR. And it's not showing in the orders because we have it marked as hidden. If we wanted it to show up, we could enable it remotely through Marsupial Instructor during the sim, or alternatively, we could program a state to, let's say we program state 1. Let's just do that. Let's flip this. Let's program a state to flip this from disabled, or this, the order, make it visible. So we're going to show it. So we're going to switch this from enabled no to enabled yes. So let's look at our states. We have no states here. We're going to click on new state. We're going to have a bunch of different options here. So the chart's always going to start in state 0 when you open it up. So we can only start programming from state 1 and beyond. So we're going to program state 1. We're going to say the state description is just a note to you to remember like where in the sim, like what's going on. We're going to say patient, short of breath, students call physician. We have an option for modify type. So this will let us pick what we're modifying in the chart. Are we modifying an order? Are we modifying a result? Are we modifying an image? And then there's some advanced options here. We have a date advance and a time change. So you can do this. You can advance the chart. You can change like the clock that's in Marsupial EMR to a certain time. The date advance will let you move the dates around for everything in the chart. So these are kind of advanced. I'm not going to go over that here. I'll make another video about more advanced state programming, but the order results and imaging is pretty straightforward. When you click on one of the modified types, it'll automatically pull whatever you have already pre-programmed into the chart. So we have all these labs that we can change. The thing with states is that you can only change something that's pre-programmed in the chart. You can't type in a new order like freehand and send it to the students. It has to be pre-programmed into the chart. So if I want the students to call for a furosemide order, I need that furosemide order already programmed, and then I'm just changing it from hidden to visible. So that's what we're going to do now. We're going to go to orders, and then we can see the orders we've put in there. We have this stat Lasix order here. When you click on it, it's going to preload these two boxes down here. show enable item is unchecked, so we know this furosemide order is currently disabled. We want to enable it. So we're going to click this. We're going to change it from disabled or hidden to enabled or shown. And then we're going to click add. So now we've got this new state in here. Let's say we want to change something else as part of state 1. You don't have to keep putting the state description in. You only really got to put it in one time. It's just a reference note for you when you're editing. And when you're controlling it remotely, you can see like a list of all the states and a description for them. But you don't really need to put it on every line. Oh, but you can if you want to. Let's say we had this troponin was, let's go back. Let's go to results, and we're going to make this, we're going to make these later troponins hidden. So I'm going to hide this troponin at 8, and I'm going to hide this troponin at 10. So let's say the students are supposed to get a new lab result mid-sim. Around the same time they call the physician. They're going to get a new troponin result. So we're going to click on result here on our new state. We're going to pick our 8 o'clock troponin. And when we click it, you can see it's currently disabled. So we're going to enable it. So these are both going to happen at state 1. All state 1 changes will happen at one time for every state. So when I advance to state 1, all the state 1 changes are going to happen simultaneously. You can have multiple states. So if there's 2, 3, 4, 5, 20 different states for your sim, you can do that. Just keep in mind that they are linear only. You can only advance linearly. You can only go from 1 to 2 to 3 to 4. You can't skip around. So all of your sims should, depending on how you design them, should be predictable in what the students are doing. So the flow of the sim should be pretty rigid, right? So you really shouldn't need to jump around. If you do have like a diverging sim where like the students make a choice and it can go left or right, like a fork in the road type of sim, pre-programmed states might not be the best option. Another option would be to just remotely control the EMR, and then whoever's running the sim is picking what changes in the chart through Marsupial Instructor. So I'll have another video on Marsupial Instructor that will show you how you can control the chart remotely. If you have like a diverging sim like that, then the states aren't really going to work. All right, so let's take a look at what this looks like when from the student perspective. So let's reload our database in Marsupial EMR so we get the changes that we just made. Open up Michael Holloway. We can see his orders. We're in state 0, so we just see, we don't see any of the, like the stat furosemide order, right? And under results, we don't see the 2 troponins we hid. We just hid them. We shouldn't see them. So let's say it's been 10 minutes and now the students are calling the physician for some orders. 2 ways we can change the states. Remember, we can control it remotely through Marsupial Instructor, or we can do it locally with the next state button. So we'll assume that we're having the students control the states. As the instructor, I would say, like at the end of the phone call or right after, I would say, students, click the next state button and advance to state 1, and that will change the chart. It'll give you a dialog box confirming you want to advance the chart, just so you don't inadvertently hit it more than once. We'll say yes, and now we're in state 1. And you also see we've got some new orders and new results flashing up here. Let's click new results. Hey, that's that troponin that we had hidden before, and now it's enabled. So this is like a new results flag box. it will show everything, all the new results that have popped up. And then we can hit OK, and it'll clear the results flag, and then it'll show our lab results in our results tab now. That's our troponin. We've also got new orders. All right, we got the stat furosemide, 60 milligrams. Click OK. And now we'll have that order there. And now in our MAR, it's going to show up here. Now we can administer this by scanning it. So it's kind of a quick rundown of how you can set up orders and change the state of them. All right, so that was just a quick description of how to make like a medication order, how to make it show up on the MAR by adding MAR entries, and then how to change the state of the order to hide or show stuff on the MAR. You can hide and show or disable and enable orders, results, and imaging the same way. We did the result, but you can do the same thing with the imaging too. All right, let's look at another medication order. This was a pretty simple one. It's just an IV push medication. Let's look at a PRN medication next. So let's just make a new order. Say the time the physician put the order in is 7 a.m. It's a medication. We're going to search our med library for a medication, for a PRN med. I'm going to sort it by generic name. Let's just do Tylenol. Actually, let's do this Percocet here. So I want to show you what it looks like to do a combination medication. So let's do the oxycodone 5 milligrams and acetaminophen 325 milligrams. The dose is 1 tablet. So if you're doing combination medications, this is how you have to enter them. You're going to have to put the dosage of like the physical med in the order name. So for example, you can't do oxycodone and acetaminophen and then in a dose put 5/325. Marsupial can't read that. It uses this dose value to do math on when we're scanning meds. So Marsupial supports like having multiple like physical doses of medication for one administration event. So for example, if we had to give 40 milligrams of furosemide PO, then I could scan 2 20 milligram tablets for 40 milligrams, and that would be okay. Marsupial supports that, but to support that, it's doing math on this dose value. So it can't do math on 5/325, right? It has to be like a number. So if you want to do a combination med, like a Percocet, you're going to have to type it like this. The dose is going to have to be in generic name, and then your actual, like the dose you put here is going to be how many pills or how many capsules or whatever. So let's do this Percocet. It's going to fill in a bunch of the information for us. It's an enteral medication. It's going to be PO. The dosage is going to be 1 tablet. We're going to do a PRN dose here. We're going to see our PRN frequency is every 6 hours. The brand name, will fill that out. Okay. Since this is a pain medication, let's give the students some parameters. Let's say give for pain rating 4 to 7. All right, and let's click add. Now, because we made the medication order, we know we need to make a MAR entry, so it shows up on the MAR, right? So let's click on Generate MAR. This is true even for PRN and continuous meds, because you know, you don't have anything that physically shows on the MAR for a PRN order that hasn't been given yet, right? There's no scheduled time for it, but we still need a MAR entry so students can scan it. So once they scan it, they'll be able to select this entry and administer it. So make sure we have a MAR entry for all of our PRN meds and continuous meds to allow the students to scan it. If you don't have the MAR entry for it, they won't be able to scan the med and administer it. When we hit generate MAR for the PRN dose, it left this time to give blank because we're not going to have a scheduled time. And we can't even enter one here. So don't worry about the time to give for the PRN and continuous meds because they're PRN and continuous. Everything else looks right. So we'll just leave it as it is. Don't even gotta change anything. All right, let's say we want the chart to reflect that we gave a PRN dose of this medication maybe 4 hours ago. So we could generate another MAR, or we could go to the MAR and copy this one. Let's just generate another MAR entry. So let's say we want on the MAR to show that our patient got a Percocet at 3:30 in the morning. So we picked administered, yes, and now we have this admin time box here. It has a little star here. It says enter only one time for the administration event. We're going to have at 3:30 in the morning, our patient got one tablet of this Percocet. So now we'll have on our MAR one administration event already given, and we'll have one that has not been given yet that won't show up, but will be able to be signed off. Let's take a look at that. We'll reopen our database, open our patient Michael Holloway, and look at the MAR. All right, so now we've got this Percocet here. We've got our comment. We have the administration event at 3:30. And then we have a MAR entry that's hidden, but is available to be given when the students scan the medication. All right, so let's do one more example of a PRN med. Let's say we want to give more Percocet for a higher pain rating. So let's say the patient's pain rating was 8 to 10, and we want to give 2 tablets. So let's make another order for that. We're going to copy the order. We know the original one is 49. This new one is 50. So we're going to open the new one, and we're going to change it. We're going to say our comment is for 8 to 10. And our dose is going to be 2 tablets. So in reality, the patient's going to get 10 milligrams of oxy and 650 of Tylenol. But the way we have to write it, because it's a combination med, they're just going to get 2 tablets of this. And we have to create a MAR entry. Let's generate that. And then we know this is the one we want to edit because it's order ID of 50 and it's 2 tablets. So we're just going to leave it as it is because the patient didn't get 2 tablet dose. We want to make it so the students can just administer it if they need to. All right, so that's PRN doses. I think one more thing I'll say is that the PRN doses, your dose has to be defined. It has to be, it can't be a range. So like if you wanted to, this might be a bad example of where you want to do a range. Let's do let's just pretend the nurse could decide the patient's getting 1 to 2 tablets for pain of 8 to 10. If you try to do that, it'll give you an error, and it says invalid dose entered. Scheduled in PRN meds must have a fixed dosage and cannot have a range. If a range is required, leave the dose blank and type the range in the order comment. So if you want to have a range, you can do that. Insulin would be a good example of like a sliding scale insulin where you have a range you want to administer, or have the students like pick the dose through a range. If you want to do that, then leave this dose empty or blank, and then just type the instructions for the range, like that. This would be a bad example of when you'd want to do that, because you really shouldn't be giving ranges of narcotics. Let's do a insulin order, a sliding scale insulin order. Let's see if Tristan Ali has one already, though. They do have one. So instead of remaking this whole order, we're just going to copy it to Michael Holloway. Copy to Michael Holloway. And then we'll go open Michael Holloway. And now we got insulin order here. Let's open that up. We're just going to change the date to reflect our simulation. We have a comment here that has our nomogram for giving insulin, or sliding scale. You can type in whatever you want. But like I was saying before, for a variable dose range, you leave the dose blank. Still fill out the units, but just leave the dose blank, which you wouldn't want to type as like 0 to 6 units. Can't do that. If you want the range, leave it blank and then type the ranges in the comment box. This is going to be a scheduled insulin. It's going to be ACHS. So we've got the brand name here. It's sub-Q. It's parenteral. The time the order was put in, let's just do 6. Try to make these order times realistic, that the order's put in before the MAR entries times. It doesn't really check that, but it looks unrealistic if it doesn't line up right. All right, so it's ACHS. We know we have to make 4 MAR entries for this. So we can just generate 4 of them. 1, 2, 3, 4. We'll go to our MAR. Now we have these 4 here. And now we just got to change the time. It's a scheduled med, so we have a time to give. Let's do 7 a.m. We're going to leave our dose blank. Let's do 11 a.m. Let's do 4. And we'll do 2200. All right, so our dose is blank. So let's go back to our EMR and reload our database. We'll have the sliding scale here. On our MAR, we'll have the sliding scale, and just the dose will be blank. So when they go to scan the medication, they'll have to type in the number of units they're giving. So that's how you would do a dose range for a scheduled medication. All right, let's talk about one other medication order. It's going to be continuous meds. So this would be like a continuous IV infusion. It's a little different in how we set up the order. So let's look at Tristan Ali again and see if they have one already. So this is a good example here. We've got a couple of good examples. So we've got a normal saline infusion. And we got a normal saline flush. And we have this vancomycin here too. So let's just take this normal saline. Let's say we want our patient to have a continuous normal saline infusion running. So we'll copy this to Michael Holloway. So the order we copied was for a bolus. It was for a 500 milliliter bolus of normal saline. We're going to make a continuous infusion. And when we said before, when we make continuous infusions, our dose is going to be our infusion rate. So let's say we want the students to administer at 150 milliliters per hour. There's a whole bunch of pre-programmed rates in here under the units. So everything above this separator is for like scheduled PRN meds. Everything below is for continuous infusions. They're all rates. And we've got IV infusion selected as our route. It's parenteral. This order is hidden right now. We're going to show it. And we don't need a comment. You could type like infuse at 150 milliliters per hour if you wanted to. It's not necessary because it'll show up in the order. It's up to you though, what you want the students to see. So let's save that order. And we have to make a MAR entry for it. It's a medication order. So let's click generate MAR. And now we'll have our sodium chloride, 0.9% infusion, 150 milliliters an hour. There's no time associated with it because it's a continuous infusion. And they work kind of similar to PRN meds, right? So if every time your like bag of fluid runs out, you're going to need to scan a new bag, but you don't know what time that's going to be at. So you're still going to need a MAR entry for it, even if it's not going to like show up, scheduled time on the MAR is not going to show up. So this is our MAR entry so students can scan this med. All right, so that's our continuous infusion. Let's look at another. Let's look at a medication drip, a continuous drip of a medication. We're going to go to Med Library and we're going to go to Search. We're going to search our Med Library for, let's say our patient needs norepinephrine. All right, I got a couple levo drips in here. So let's do the 16 milligrams in 250 of D5. The medication dose is 16 milligrams. And it's a bag. And it's the barcode for it. So we're just going to double click this. Again, make sure the description matches the drug in the Med Library. Because we picked it through the Med Library, it's going to copy it for us. And it's going to fill some of the stuff out for us as well. So we need to change this to continuous. And we need to change this to a rate. So we're going to say that our levo drip is titratable based on a nomogram. So we're just going to say titrate to map greater than 60. And we'll just give some more parameters. We'll say initiate at, what units do we want to use here? Let's say, we'll use milliliters per hour. It's going to depend on what your facility uses. We'll say we're going to start at 5 milliliters an hour. Some places might use mics, whatever you want to use. So initiate at 5 mLs per hour. Can increase or can change infusion rate every 5 minutes. Let's say every 1 minute, every 2 minutes, however fast you want to go. Our admin route's going to be IV infusion. Brand name, be Levofed. We'll just leave it blank though. All right, so for the rate, you can put whatever you want for the rate for continuous infusions. It doesn't do math on the rate here. The rate is just it's just telling the students what the possible rate is. So the rules we had for the scheduled and PRN meds don't apply for this. We can give a range in our rates field for continuous infusions. So there's no real upper limit on norepinephrine, but we will say the max rate is 200 milliliters per hour. And we'll click add. So that's an example of what your order would look like for a continuous drip that's titratable with a range. Alternatively, you could put the range up here too, in the comment section, whatever you want to do. This is how I do it for my simulations. This could be 5, and it's not going to limit the students for what they can enter when they sign off the medication. This is just going to show them like a suggestion of what the rate should be. So, for example, for our normal saline, we wanted the rate to be 150. There was no range, so we put 150 there. For meds with a range, you can put the range there, or you can put like the initial infusion rate. Or if you wanted to pre-program like a MAR entry to have a specific rate, like let's say 2 hours ago, the nurse put the Levo drip at 10 mLs an hour, then that's where you would put that in the MAR entry, not the order. For the order, I recommend putting the range if there is a range. And now we have to make a MAR entry for our order. We'll generate MAR. And now we've got our MAR entry for our Levo. We don't got to change anything. It's ready to go. All right, we'll do one more medication example. Just want to go through all these because it's a little particular with how you have to enter stuff to make it work right. I tried to improve a lot of the usability with Marsupial in version 2. So a lot of the mistakes it would let you make, you can't make anymore. It'll give you an error. But I just want to go through these anyway. Well, the last one we'll do is like an IV piggyback type of med. Let's search our med library for, I think we had a vancomycin in here. Yeah. Let's do a vancomycin, 1 gram and 250. So our medication dose is 1 gram. That's what the patient's getting. On here, I have some fields filled out in the med library for the location of the med. So because I have these filled out, it'll show up on our EMR. And those are editable in Marsupial Editor. Again, that'll be a different video on editing the med library, but we'll see those show up when we look at the patient's chart in Marsupial EMR. All right, the IV route, or the route's going to be, admin route's going to be IV infusion. The dose is 1 gram. Let's say it's just daily vanc. And it's going to be a scheduled med. It's going to be enabled, and it's active. We don't really need a comment, so let's just add it. We got to make a MAR entry for it. We only need 1 because it's daily. The MAR only shows like today. It only shows 24 hours of the MAR. And it can't look backwards. So we only need 1 entry for Vanc. And we're going to say it's going to be due at 10. That's it. So I recommend when you're putting meds in the med library and making orders that you format it like I have here for piggybacks. Put the drug, the dosage of the drug, and how, like, what volume it's in. That way it's clear that this is an infusion. You could even write infusion at the end of it. I typically only write infusion for things that are continuous. So for example, there's a whole bunch of different formulations of normal saline. It could be a bag of normal saline. It could be for like an infusion. It could be a syringe of normal saline. It could be a bottle of normal saline, and so on. So if you make everything sodium chloride 0.9%, then it can get kind of confusing on what's what. So I make all my infusions infusion. We talked about the combination drugs and how they have to be written. Anything that's going to be continuous infusion, like a medication, again, I write it like this. That's a change from version 1. So if you're listening to this and you are upgrading from version 1 to version 2, you might have to change some of your dosages. I changed how Marsupial handles the dosages. So keep that in mind. Okay, I think that's most of the med orders we can talk about. So I'll show you one more thing on the MAR is, let's do a state change. Let's say we want to discontinue one of these medications, or any order really. Let's say we don't want our patient to get 2 tabs of oxy anymore. We want to discontinue this order. We want to change that during the sim. So it's going to be enabled at the beginning of the sim, but we're going to make a state. We'll call it state 2. We'll just call it discontinue oxy 2 tabs. The order, we'll pick this 2-tablet oxy order. It's currently enabled and shown to the students. We still want it to show the students. We just want to change the status to discontinued. Let's add that as our second state. And then let's go look at the EMR. Let's reload our EMR database. Reopen Michael Holloway. Got a bunch of orders that we put in here. Let's look at our MAR real quick and make sure everything is in here right. Got the Vanc at 10. We've got under continuous, we have our normal saline infusion and our Levofed infusion. We can currently have this Percocet is still active, the 2-tab Percocet. Let's advance to state 1. We'll get those new orders we put in, the stat Lasix and this troponin result. Let's advance to state 2. And we can see we've got this discontinued 2-tab Percocet order that's crossed out. So that'll reflect on the MAR here that that's no longer able to be given. And under orders, if you have this checkbox here checked, show completed discontinued orders, then we'll see our discontinued orders. If you uncheck it, we won't see them anymore. FYI, this box here is not persistent. When you close it, close the EMR, it's not going to remember this here. If you want this to be persistent, there is an option under settings to do that. Okay, so I think that covers all the different combinations of med orders that we can do. What else can we look at the editor here? I think that's it. There's a couple more orders that we can talk about. Some special use cases for orders here. Advanced directives is one of them. So by default, if the patient does not have an advanced directives order, their code status will show up as full code, as we see here on Michael Holloway. He does not have a advanced directives order. It's assumed he's full code. You can override that by making an advanced directives order. Let's make him DNR CCA. And we'll fill in the time and date. And we'll click add. Let's reload our EMR. Now when we open up Michael Holloway, he's got our DNR order, and it reflects in the code status up here. So that's another special use case for orders. The advanced directives and medications are the only ones that interact with other parts of the charts. So the admissions, the labs, nursing, nutrition, and respiratory are just kind of like dumb orders. Whatever you type in here, it's just going to show on the order screen and doesn't interact with anything else. All right, I think that's most of what I can show you for the MAR. We went over everything, I believe. Again, I recommend looking at the example patients in the instructor video demo database. So look at Tristan Ali. Has a bunch of orders in here. You can just copy these, or you can just use it as a reference for what the chart could look like and how it should be formatted. If you have any questions, we do have a discussion board on the Marsupial GitHub site under the EMR website. If you have any questions, you can always go there and post on the discussion board, and I can try and help answer them for you. Other than that, again, if you want to learn how to edit the med library or edit the monograph drug library, check out the other videos on this channel. And then if you want to look into doing some advanced state programming, I'm going to have another video on that as well.